So when you would come to see me in the office, there's no copay. And basically you can have unlimited visits. Now most people, after they get to a certain point and feel comfortable with their care, they don't feel the need to come see their doctors often. We call it getting them to cruising altitude.
So you're in the doctor's waiting room, and then they call your name and you finally feel so excited, and you put your magazine down and you go into that little room, and then you realize, I should have brought the damn magazine with me, because you have to wait some more and more. Dr. John Dygert has a potential solution. His company, I want to make sure I got it right, Pinnacle Advanced Primary Care.
You got it.
All right, now, this is not quite concierge medical service, but it is really different. Explain it to me.
It is different. It's magic, actually, I would say, yeah. And it's kind of an offshoot of concierge medicine in that it's direct pay. But it's not just a retainer.
Just to make sure that concierge service is, I pay a lot of money, and I'm one of a few patients that this doctor sees, and they give me great service, and I call them up. It's country club kind of stuff, and it's wonderful. Should I have the money?
Yes, but this particular model will apply to a lot more classes of socioeconomic status, which is really great. And that's
I might be able to afford this.
I'm not sure that you'll be able to afford it. Yeah.
So, but it's when you say, I'm familiar with cash for care, which as insurance payments go higher and higher, the idea for cash for care is when a doctor says, I'm not dealing with my insurance companies or any insurance company, which takes almost half of what the cost is of anybody's visit, is the doctor's office chasing insurance companies to get their predetermined amount of money. And I've known guys who just said, I'm not doing that. I'll charge a flat fee for this rate, this rate, this rate, and that's it. If you want to play with the insurance company, you do that. And it's been really successful because then the doctor gets to be a doctor instead of a collection agent.
Yep, absolutely.
Is that what this is?
No, this is a little bit different than that. This is a monthly membership fee. So it's just a recurring fee once a month. And the difference between that and the cash for care is still a fee-for-service type model. Whereas this, you're a member, so when you would come to see me in the office, there's no copay. And basically you can have unlimited visits. Now most people, after they get to a certain point and feel comfortable with their care, they don't feel the need to come see their doctors often. We call it getting them to cruising altitude. But when they're a member at our practice, we kind of just apply everything we can to the care of a patient, which doesn't necessarily mean an office visit all the time. Sometimes it's just a conversation by email or phone or text.
Yeah, and sometimes I just want to talk to the doctor.
Absolutely.
Will you give me a prescription for this? No, we need to see you. And all right, this is what I don't get. I mean, I get the idea of concierge care. I get it. Your friend handed me a cost sheet here, and for an adult, it's under $70 a month.
Mm-hmm. Yeah,
right,
very affordable.
Now this obviously is a scam. You know, there's no way I can see a doctor as often as I want to see a doctor for primary care. I mean, you're not taking out my gallstones or anything, but for the usual physicals and colds and flus and aches and pains, and for $70 a month.
Well, I hate to disagree with you.
It doesn't seem to work for me.
Well, I hate to disagree with you because we just met, but that's exactly what it means. It's actually a lot more what people want. Because when you look at surveys, and I've looked at surveys that thousands of patients, all age ranges over multiple states. So it's a good sample size. A couple of them were done by PwC Health Research Institute. One of them was done by Solution Reach, all recently, 2017, 2018, 2019. What patients want is three things. They want convenience, they want a strong relationship, doctor-patient relationship, and they want it to be cost-effective, okay? Now, they didn't quite say it like that. In answering the surveys, like if it was the strong doctor-patient relationship, they would say things like, I want to have the ability to make decisions with my doctor kind of together. Or they would... you
want time with your doctor, and you want to be able to talk to your doctor, because it has changed over the years where you used to look at your doctor, and now you just look at the side of your doctor as he's typing things in, and he just asks you questions, and you don't have to be there. You could be a phone call at that point.
Yeah, yeah, and I don't want to disparage the doctors in the traditional system because they really can't help that. That's just the way I mean, it is built entirely upon an insurance system where you are required to code in order to bill, which means that you have to click a certain number of boxes in exactly the right way. Otherwise, the insurance can deny the claim for the patient.
We've turned doctors into accountants in that there are literally, tell me if I got this wrong, something like 20,000 different insurance codes for every time when you visit. If it's a strep test, it's this code. If it's a long visit, it's that code. And that sheet, it used to be a sheet of paper, they would kind of check things off.
Yeah.
Those would be like the top 100, but you spend all your time doing that. You don't do any of that. You just sit down with the patient.
That's exactly right, which frees up so much of your mental bandwidth to be able to focus on what's actually in front of you, what the patient is dealing with. It allows you to kind of make that impact that you always wanted to do when you were in medical school.
All right. Listen, this is a scam. I'm going to break through this and tell you, we're going to expose it right here.
Okay.
All right. I need blood tests or some other tests. Is this included in that?
So some tests are included. So like, for example, if you need a strep swab, right? You got to come in with a sore throat. We want to see if it's strep or whether it's
COVID.
a viral thing. Or COVID. Yeah, okay. We can do COVID. And we can do flu. Some tests are point-of-care tests. Those are all included under the membership. So like an EKG, 12-lead EKG, that's all included in the membership. Urinalysis, included in the membership. Other lab tests that we have to send out to the lab, we've actually negotiated with different labs in the community to drive those prices down. Because it turns out the labs don't really like dealing with insurance companies too much either because they got the same overhead problem. So, and then also that provides price transparency, which when you, who knew, when you put that out on the free market and get a little competition going, it drives those prices down.
On those tests.
On those tests, and x-rays, MRIs, CAT scans, and prescriptions.
All right, so like an MRI. This is an expensive thing. I've been through it. What does an MRI cost? If I go through you and you go, hey, John, I think we ought to get an MRI to see if that's actually a mouse in your brain, what is that going to cost me?
So usually that's around between $350 to $400. Now that's, yeah, exactly. So normally that's unheard of. Yeah. I've actually ordered a head MRI, a brain MRI a couple of years ago for $180. So now that was a special at the time, but it still is. And plus you know what the price is up front. There's no surprise that you get in the mail. It's like, oh, that's how much my insurance covers. Turns out it's not that much. You know, it's like if you go to a restaurant and you had a menu with food that didn't have the prices next to it. That's what it's like when you go to the doctor now.
But then again, we don't have insurance. We really have prepaid medical. And so you've already paid up front, so you don't care what the menu is. You're just always going to order the steak and lobster because you've already paid for it. So here, you'd be a bit more judgmental. All right, what if it's something serious, which is like, John, you know, you need to see a specialist. Well, then I'm back into the old system, right?
Well, yes, but not necessarily. If it's something really serious, like an emergency room visit, like if you get in a car accident or you have a heart attack or a stroke or something like that, that's actually what insurance was made for. Is a financial tool to hedge against a huge outlay of cash like that. Exactly. So it was never really meant to pay for labs, prescriptions, and all this kind of stuff. It just kind of slowly swallowed all of that stuff up.
Swallowed up because the government kept adding mandate after mandate after mandate. You'll cover this, you'll cover this, you'll cover this, you'll cover this, and off it grew.
Well, and then all the private insurances kind of have to mimic what the state systems do. So like Medicare, Medicaid, they have to code and bill in a similar fashion.
All right, so I'm still wrapping around the numbers here. So you get $70 for me a month. You have 10 of us, that's $700 a month. You get 100 of us, that's $7,000 a month. And so if you get 1,000 of us, then what? That's $700,000 a month. Am I doing that right?
I think it'd be $70,000 a month. But
how do you? Listen, I know doctors. I know the country club fees. I know the green fees. I know the mistresses you have to pay for. I know all these costs that doctors have, plus the very expensive divorce that happens when you have to give them half your practice. So how do you pay for all of it at that price? I mean, for me, it has a hard time adding up.
Well, you already mentioned it earlier, which is overhead for billing and coding, which, by the way, is something that adds no value to the patient, to the consumer whatsoever. Have you ever been impressed by how well your doctor is able to code for you?
Yeah.
Like, that doesn't help you. So and the overhead for billing and coding is up to 40-50%. That's from Health Affairs. I mean, it's amazing.
Let me repeat that for people who don't quite get it. When you go to the doctor, half of what you're spending is for their accounting to get the money out of the insurance company, and they've figured out payments and prices, and you can't charge one guy more than another if you're taking insurance. That's all they are. They're guys on computers.
Right. Which is really not what we went to medical school for, and it's definitely not what patients expect when they go to the doctor's office. So that really helps a lot, make it a much more viable model. And instead, we can put all the energy into actual patient care instead of learning the new language. Essentially, is what you have to do in order to learn how all the codes and so forth, and then also the whole procedure in order to get reimbursed by the insurance company. So it really helps a lot.
Right. So $70,000 a month. You bring in with 1,000 people. Wow, that's still, how many doctors are there?
Well, it depends on the practice. A lot of these, I mean, the neat thing about this model is it makes it a viable option for your mom and pop type practice, like from 50 years ago, where it can just be a solo doc running their own patient panel on their own. But our practice, for example, has a couple of doctors. There are much larger practices.
Are you on call, in other words? Because I've noticed that whenever I get sick or somebody in my family gets sick, it's always on a Friday afternoon.
Yeah, that's exactly right.
It's always.
Always.
And so I need to see them on the weekend or talk to them at least. Are you on call?
We are on call.
Really?
Absolutely, yeah. So, and we can cross cover for each other, but we do tend to just be on call for our patients if they want to send us a text.
Are you running this like out of your garage? When I go there, will you like put me on the hood of your Ford truck and do the stethoscope? Is that?
It's a little bit nicer than my garage. My kids have a lot of bikes and stuff strewn about my garage. It's actually a really nice little facility. Homey, warm, comfortable. Yeah. It's just like a clinic.
Technology from the 1800s, or?
Oh, no. We've got a state-of-the-art EHR. The meds that we bring, we have a pharmacy in-house that we don't get from Honduras or anything. It comes from a company called Andameds in Florida.
See, for $70 a month, this is mind-blowing because you can, one visit is, to the doctor is, 3 months of what you pay here.
Mm-hmm. Yeah.
All right. Let me do it from your side, which is you get a hypochondriac who just wants to go and spend an hour a day talking to you in your office because that's what he or she needs. The whole thing blows.
Well, in theory, that's true. If you have you have an entire panel of high utilizers, this model wouldn't work. But what happens, and what we've seen, is that the more, and a lot of times that is what happens at the very beginning. People are not comfortable with the way that their healthcare is being managed. But if they come in frequently at first, we get them up to what we call cruising altitude, and then they're a lot more comfortable. They develop something called health confidence. Health confidence is kind of patients' subjective comfort level in dealing with their own healthcare issues and their level of engagement. It's kind of a word that describes that.
I think all of us know when there's something wrong. I don't know what it is. Something not's right. I'd love to go see a doctor, but I don't. I'm not dying or anything. I just need to see a doctor.
Right, and this removes that barrier. But really, I mean, I'm sure we could probably set up some boundaries if it ever came to that. But so far, it's never really come to that. People get comfortable and they're fine. So your incentive
here is to get as many members to join this little club as possible. So yeah, you say you're going to have time for me, but you're not, because all you're going to be doing is trying to get new members. So I'll be waiting longer in that waiting room.
We can almost always get you in same day or next day at the very latest. Our patients really, we have a waiting room, but I'm not sure what for. They hardly ever stay there for any length of time. Our panels are about half the size of a traditional practice's panels, which we can do because of
What is a panel?
A panel is the patients who are assigned to a given physician or provider.
It's your portfolio of patients.
Portfolio of patients. Yeah, that actually is a more artsy way of.
I'm an artsy man.
I like the way you put that. So yeah, and at least half, sometimes even less than half of the traditional practice. So we have a lot more time to spend with our patients.
How do you keep that from sneaking up? I mean, the incentive has got to be to start stacking and packing these patients in.
Yes, but that would also kind of get us right back to where we started from, where we're just barely, keeping our heads above water like it is in traditional practice. Because I've done it the old way, and let me tell you, this way is a dream compared to that.
As a doctor.
As a doctor, well, and
what about as a business owner?
Well, I've never been a business owner in the traditional.
I mean, as far as making money yourself. I mean, so doctors make real money. Are you making more money with this?
No, not in the direct primary care model. The doctors will make about what they make in traditional practice. Of course, it depends on the region of the country and that kind of thing as far as what compensation is. Colorado's not great, by the way, but it's a very comfortable living that you can make with a patient panel of 600 to 800 patients, which is, like I said, less than half of the traditional.
All right. So the incentive for the doctor is, I get a smaller workload, I can spend more time doctoring.
Yeah, it's still a lot of work, but I think so. Burnout's a big problem with doctors, and there's also a shortage of doctors going into primary care for that very reason. So September this year, Medical Economics came out with an article saying that 4 out of 5, that's 80%, of all doctors are burned out. So that's the traditional system not working for them.
What, you doctors get a bitch more about it? I'm burnt out. We're all burnt out.
We're really good at that, believe it or not. Yes, but having done this for 4 years, it's just a dream. It's exactly the way that you thought it was going to be like when you're imagining what your job is going to be like, getting you through those 36-hour shifts, getting yelled at by general surgeons, and, well, I guess not always surgeons. It's usually surgeons that do that, yeah.
Let me see if I can get them. So the money works on your side. You're not making tons more, but you're living a better lifestyle, less stressful, and you get a doctor, which is what you want to do.
And you feel like you're making a real impact for these people.
From my point of view, I get to see a doctor pretty much when I want to see a doctor and feel like they're actually talking to me. That's huge. But I've got to make the money work. So I still have to have my insurance, because you're not a HMO. This is just primary care. And so if you find something larger, I still have to go and do the other stuff. But this makes me want to do a high deductible plan so that I can get my basic stuff done for $70 a month, which still sounds weird. But I still need this other plan. And as those other plans are harder to get, thanks to Obamacare and other mandates, is it really worth it for somebody to spend an extra, $700, $800 a year?
Well, actually, we've been working on that very problem, because high deductible plan is one way to go, but there are also health shares, there are supplemental health insurances out there that can kind of fill that gap between what we can do in primary care and those larger healthcare expenses. So, and we're kind of working on that all the time, and it's getting to be it's getting to the point where when you compare what we are packaging with our membership model in with these other products, that when you compare them, side by side, it's going to be an absolute no-brainer. Part of the reason that we look so good is because the rest of the system is just so messed up.
When you realize how much in healthcare you pay for, that has nothing to do with healthcare. Mm-hmm. You're paying $3 for an aspirin. It's just insane, and $3 for the accounting for each of the aspirin. It's insane when the market, if left alone, comes up with great ideas like this. This is incredible. How long have you had this practice going?
We started this practice June of this year, and we've been growing rapidly since we opened our doors. It's been pretty exciting.
And if you start to get price creep on this, and it goes up or the service goes down, I can just leave.
Then it's on us. Yeah,
And it's on you.
yeah.
Oh, and if you have enough people, you might not care.
True, yeah, and it's not just us. I'd like to point that out. Colorado actually is a state that has one of the highest number per capita of this type of practice in the state. Like, for example, I used to work for a great company in Colorado, and DPC Frontier has a great list of the practices.
Who's that?
DPC Frontiers is a advocacy group for direct primary care. DPCfrontier.com, and they have a list of states, and you can just click on the state, and you can find a
Give that
practice
web
just
address
like
one more time, because that's a good
DPCfrontier.com.
All right. And if people want to get a hold of you and Pinnacle Primary Care, did I get that right?
You got that right.
Advanced Primary Care. There you go.
Yeah.
Oh, it spells pace. That's very clever. All right. See, you're a marketer. All right.
Maybe a little bit.
How do they get hold of you?
They can contact us at 719-465-1579 or get a hold of us through our website. That's pinnacleapc.com.
Pinnacle APC.
Advanced Primary Care, yeah, pinnacleapc.com.
So leave it on this, yes or no thing. So I'm paying about, what, $17 a month for Netflix. For $50 more a month, I could go to the doctor basically whenever I want.
Mm-hmm. Yeah, in a better system. Yeah, that's a good analogy.
John, thanks for being with me.
Thank you so much for having me. Enjoyed it.
If you enjoyed that conversation, by all means, click one of these other great programs. We have the best conversations with the most fascinating Coloradans. And subscribe to our channel. Just click down below and hit that little bell button too. You don't want to miss a single show.